Today's topic is eye pressure. Everybody has a certain level of BP, that is, blood pressure in the body. For the blood pressures to be termed as normal, there is a certain range. These blood pressures may be low, normal, or high. And nowadays, everyone knows the ill effects of having high blood pressure. So, like the blood pressures of the body, every eyes has its individual eye pressure. In the eyes, these eye pressures are generally termed as IOPs, which stands for intraocular pressure. This eye pressures doesn't have any relationship with the blood pressures. Now, like the blood pressure, these eye pressures too has a certain normalized range, and if the IOPs are more than the normalized range, then a detailed eye examination becomes essential, because the high eye pressure may damage the nerves inside the eyes, and if neurological damages are caused due to the high eye pressures, then it causes irreversible losses. In the case of high eye pressures, few more investigations are needed, whose names are like gonioscope, fundus retinal examination, field testing, etc. So, for the eye to be diagnosed to have glaucoma, each of these test results should fulfill certain criteria. If in this test the results are subnormal, which resembles with the patients having glaucoma, then the patient are treated in the line of glaucoma. But sometimes, even if the eye pressures are normal, then too sometimes there can be neurological damages inside the eyes, inside the eyes. So in this case, the patient will have to be treated in the line of glaucoma. But sometimes the eye pressures can be high, but 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 they, but we don't find any neurological changes and neurological damages, and the investigation results are also found. If the investigation results are found normal, then in this case there is no active treatment required for this case. Hence, just by knowing the pressure, just by knowing the eye pressures, it is not possible to comment whether the person will need treatment or not. One more thing is that glaucoma has various types, and only an eye examination enables the eye specialist to know its exact type. Some kind of glaucoma causes severe pain in the eyes, and few kinds few kinds of glaucoma doesn't at all cause any pain or any redness. So it becomes very difficult for the patient to know himself or herself whether he or she is is having glaucoma. So today I'll tell you a few conditions which should make the person to go for an eye checkup to rule out if he or she has glaucoma or not. The first thing is, if anyone has someone in the family who has glaucoma, then it becomes important for him or her to go for an detailed eye checkup to find out if he or she is having glaucoma. The second thing is, if anyone gets an eye injury, then it becomes important for him or her to get his or her eyes checked up properly, because an eye injury may turn the eye to have glaucoma. Third thing is, anyone who wears high minus powered lens, that means who are high myopes, they at some point of time they may develop glaucoma. So anyone who wears high minus powered lens, they should also go for an proper eye checkup. The fourth thing is, with age, the shape and size of all the structures inside the eye changes. So it is believed that in oldest people whose age is more than 50 or 55, they are likely to develop glaucoma. So so the people whose ages are more than 50 or 55, they should go to an eye hospital to get their eye checked up properly, whether he or she has glaucoma or not. The fifth point is, if anyone sees any colored rings around a bright light, those are termed as colored halos. If anyone sees those colored halos, then it becomes important thing for the person to go for an eye check, to go for an detailed eye checkup to rule out if he or she is having glaucoma. The sixth point is, if due to some other physical conditions, if someone is using steroid group of medicines for very long time, then it becomes important thing for those people to get their eyes checked up for glaucoma, because these steroids may lead to secondary glaucoma. So these were just a very brief things about the eye pressures, but for proper diagnosis and detailed evaluation, please visit an eye hospital. So that's all for today. Please subscribe to my channel and please like and share this channel. Thank you.